speaking on the aborted suprachoroidal hemorrhage presenting as pseudomelanoma. Do not forget the psyched output.
Good afternoon, everyone. I'll be talking about aborted suprachoroidal hemorrhage presenting as pseudomelanoma. Don't get psyched out. So, suprachoroidal hemorrhage is a rare but sight-threatening complication in intraocular surgeries. It can present as a choroidal mass after surgery and cause a diagnostic dilemma. So, I'll be talking about two localized suprachoroidal hemorrhage cases which presented as a choroidal mass one day after cataract surgery. So, first patient was a 41-year-old female. She was underwent left eye phacoemulsification elsewhere. So, intraoperatively severe positive pressure was noted and IOL implantation was deferred. History-wise, examination was nothing was relevant, and on ocular examination on post-operative day 1, right eye had 6/9, which was improved to 6/6, and NS2 cataract was there. In left eye, 1/60 uncorrected visual acuity, which was improved to 6/12 with +10 diopter, and that eye was aphakic. So on fundus evaluation, there was a localized dome-shaped elevated choroidal mass lesion inferiorly was found. On B scan, there was a low to medium internal reflectivity with OCT scan showing lumpy bumpy appearance along the margins. FFA was showing early hyperfluorescence with late leakage, and ICG was showing early hypocysts with the late leakage. Keeping a differential diagnosis of choroidal melanoma, choroidal granuloma, and choroidal hemangioma, the patient was referred to ocular oncologist. So on post-operative day 15, patient came to ocular oncology department in our hospital. So on fundus evaluation, there were few choroidal folds were seen, but no mass lesion was found. So we came to a diagnosis of arrested suprachoroidal hemorrhage, and she was treated conservatively and planned for secondary IOL, but unfortunately the patient lost a follow-up. After 6 months, she came back, no mass was seen. Second case, 62-year-old female. She came with complaints of defective vision in both eyes for 6 months. On ocular examination, both eyes were having 6/12 vision, which was improved to 6/6 partial. Right eye was showing nuclear sclerosis grade 2, and left eye was showing nuclear sclerosis grade 2 with the PSCC. She was underwent left eye phacoemulsification with the PCIOL. Surgery went uneventful. Next day, fundus evaluation, there was an elevated mass lesion superotemporal to the fovea with choroidal folds. So she was treated conservatively. After 2 weeks, the mass was disappeared, just like in OCT. So to summarize, in both the cases, there were choroidal fundus mass lesion in post-operative day 1, but with conservative treatment, after 2 weeks, both the masses were disappeared. So these are the cases of aborted expulsive hemorrhage. Spontaneous localized suprachoroidal hemorrhage is a rare differential diagnosis of a choroidal mass lesion. It accounts for 2% of pseudomelanomas. With multimodal imaging, we can differentiate various choroidal mass lesions. We can just go through the differences of choroidal mass lesion. These are suprachoroidal hemorrhage, choroidal melanoma, choroidal granuloma, hemangioma, and posterior scleritis, among which posterior scleritis will be painful. When we look into B-scan internal reflectivity, melanoma, SCH, and posterior scleritis will be having low internal reflectivity, and hemangioma will be having high internal reflectivity. So a typical localized SCH will be having an appearance of dome-shaped choroidal mass lesion, and B-scan will be having echogenic or low internal reflectivity. FFA ICG will be having no remarkable features, and OCT will be showing hyperreflective lesion in outer choroid with elevated retinochoroidal complex. The pathogenesis of SCH, acute hypertony or sudden fluctuation in intraocular pressure can lead to rupture of posterior ciliary arteries or vortex veins. So in our first case, severe positive pressure was noted during surgery, so it's a most likely a case of intraoperative suprachoroidal hemorrhage. The second case is a delayed suprachoroidal hemorrhage. These are various risk factors for suprachoroidal hemorrhages, among which our first patient had hard nuclear cataract as a risk factor, and second patient had none of these risk factors. So post-operative management for localized suprachoroidal hemorrhages and non-appositional suprachoroidal hemorrhages, we can just observe in these patients because spontaneous resolution can happen in weeks to months in these patients. So topical or oral steroids, which will help in control inflammation and promote clot liquefaction. Anti-glaucoma medications for high OIP cases we can consider. Topical cycloplegics and oral analgesia to relieve secondary pain. To conclude, localized suprachoroidal hemorrhage is a rare but potentially sight-threatening complication of intraocular surgeries. Careful postoperative fundus evaluation is important to identify SCH, which enables timely intervention or conservative management. Multimodal imaging helps to differentiate SCH from other choroidal mass lesions. Thank you.
In both the cases, were there any other risk factors?
No, sir,
the globe hypotony or any other? Globe was hard.
Yeah.
In the second one, what was the
No,
nature
sir,
of the?
it was uneventful. The surgery was uneventful.
There is no other associated systemic.
Nothing was there, sir.
Nothing was there. What is attributable for the the arrested suprachoroidal hemorrhage?
Sorry, sir.
What was the reason?
Reason. So in first case, that hard nuclear cataract can itself cause this thing, and second.
So meaning to say is the duration of the surgery also has a bearing on the, because both are facus?
Both are fake, sir.
There, the patient was not hypertensive, not atherosclerotic,
Yes, sir.
no fundus evidence of atherosclerosis.
No, sir, nothing was there. Systemic
Okay.
examination, nothing was there.
In the second case, why did the surgery was done? It was a base corrected vision was 6/6 and NS2 only.
PSCC was
PSC,
there.
the
NST
patient
PSC.
complained. Okay.
Yes.
It was under a topical or
First case was topical. Yeah, both the cases were topical only, sir. For, FECO.
Okay.